In 2021, a law was passed making people with disabilities or chronic illness who weren't dying eligible for medical assistance in dying, or MAiD, if they met the requirements. What many Canadians don't realize is that this law also allowed MAiD when a person's only medical condition is mental illness. There was a delay of 2 years built into the law before the clause on MAiD for mental illness alone would take effect, and then a government bill delayed it for another year. But that take effect date is now looming. And if nothing changes, on March 17th, 2024, just a few short months from now, people with mental illness as their only medical condition will be eligible for MAiD. Statistics on Canadians and mental health tell us that many of us struggle or have struggled with mental health or have loved ones who do. 1 in 5 Canadians experience a mental illness in a given year, and by the time Canadians reach the age of 40, 1 in 2 have or have had a mental illness. We're very concerned that the lives of Canadians with mental illness will be put at risk with this change. We're also very troubled by what this change in law communicates to and about the lives of those living with mental health issues. We believe that every person's life matters, that they are loved by God and are infinitely precious to Him. Every life is valuable. To be eligible for MAiD, a person must have a grievous and irremediable medical condition. This is to mean, in part, that their illness, disease, or disability is serious, incurable, and that they're in an advanced state of irreversible decline. But mental health is immensely complex, and mental illness doesn't necessarily follow a known or predictable trajectory. In their final report, the expert panel on MAiD and mental illness wrote that incurable and irreversible are difficult terms to apply and aren't commonly used in clinical practice when speaking about mental disorders. There is limited knowledge about the long-term prognosis for many conditions, and it's difficult, if not impossible, for clinicians to make accurate predictions about the future for an individual patient. It's also known that a lack of hope for the future can be a symptom of some mental disorders. Feelings of hopelessness, despair, and an inability to believe things can change or get better are common symptoms of depression, for example. And thoughts of suicide or the desire to end one's life can also be a symptom of many psychiatric conditions. The Canadian Association for Suicide Prevention cautions that the decision to end one's life prematurely is enormous and grave and must not be made while in the throes of mental illness. To be eligible, a patient must be at least 18 years old. 18. Imagine an 18-year-old with severe treatment-resistant depression or crippling anxiety requesting and being deemed eligible for euthanasia. My son is 19, and it is unthinkable to me that if he were to experience a mental health crisis, he might be considered eligible for MAiD. It's well understood that the part of the brain that's responsible for good judgment, decision-making, and weighing and understanding consequences doesn't fully mature until we're about 25. It's hard to imagine a decision more grave than ending one's life. And how can we, as a society, contemplate opening the door to these decisions we work so hard to prevent our youth from making? It's also deeply troubling that this change could take place when far too many Canadians aren't able to access the care or treatment they need when they need it. Ahona Mehdi of the Disability Justice Network of Ontario told the Special Parliamentary Committee studying MAiD that the current situation is slanted toward assisted dying. She said, disabled youth pay up to $200 an hour for therapy, but you're looking to expand access to MAiD for these youth and to make it cost-free. Since MAiD eligibility was expanded to people who aren't dying, we've heard many accounts of people asking for MAiD because they don't have the support they need to live. People struggling with mental illness already face stigma and discrimination. They may have trouble accessing health care or experience poverty, food, or housing insecurity. And we're already seeing a clear connection between these things and MAiD for people living with disability or chronic illness. They may have difficulty finding or keeping a job. According to the Canadian Mental Health Association, 70 to 90% of people with serious mental illness in Canada are unemployed. The law is already failing to protect people in times of vulnerability. With this change, How many more Canadians in vulnerable situations, how many more of our neighbors will be pushed by crisis, lack of treatment, support, or resources toward MAiD? The EFC has consistently opposed the legalization of euthanasia and assisted suicide. MAiD must not be seen as the solution to suffering and despair. It must not be considered just another form of healthcare. At the same time, we've consistently pushed for the strongest possible safeguards and limitations on MAiD to protect people in moments of vulnerability. And there are no additional legislated safeguards for MAiD when mental illness is the only medical condition. It's being suggested that MAiD will be a last resort for those with mental illness after everything else has been tried. But that simply isn't what the law requires. Existing safeguards require things like informing a patient of their treatment options, not ensuring that the patient is able to access and has received those treatments, just that they be informed of the options, whether or not those options are actually available to them. There's no requirement that a patient have tried all reasonable treatment options. The law also requires a 3-month assessment period before someone with mental illness alone can be approved for MAiD. But wait times for care can be months or years longer than this. 1 in 10 Canadians looking for counseling will wait more than 4 months, and those wait times are even longer for youth. One Ontario specialist who treats complex mental health disorders told a parliamentary committee that there are 6,000 people on a waiting list for specialized care by his teams, and that those very sick patients can wait up to 5 years. We're concerned that this assessment period provides little protection. One of the co-hosts of the May 6 Disability Filibuster webinar expressed that concern in this way. They said, "One of my questions continues to be, how is 90 days going to help me overcome, even if I'm set on overcoming, when there are no structures or supports around to help me do that?" We're deeply concerned that Canadians who can't afford or can't access treatment in a timely manner will be more likely to request MAiD. It's also troubling that there's no requirement that conversations about MAiD be initiated only by the patient. When so many of those who request MAiD say it's because they feel like a burden, a doctor mustn't be the one to bring up MAiD to a patient, especially given the power imbalance between doctor and patient, and especially when the patient is struggling with their mental health. Yet Health Canada recently published practice standards that suggest provinces should require doctors to raise MAiD with some of their patients. It was recently reported that a Vancouver woman concerned about her suicidal thoughts went to the hospital seeking help and was told, "There are no beds, there's no availability, the system is broken." She was then asked, "Have you ever considered MAiD?" So all of this comes at a time when our healthcare system and our healthcare workers are strained to a breaking point. When the pandemic and rapidly rising costs of living have worsened mental health struggles for many, and timely, accessible mental health care and support are out of reach for too many Canadians. Over a year ago, the Centre for Addiction and Mental Health told a parliamentary committee that about a third to half of Canadians with mental illness weren't getting their mental health needs met before the pandemic, exacerbated the mental health crisis, and increased the burden on our mental health system. Recent data from Stats Canada shows that mental health across all age groups has declined since 2021, and the number of Canadians diagnosed with anxiety and mood disorders has increased, especially among vulnerable populations. It is unconscionable that in Canada, it may become easier for a person with mental illness to access MAiD than the care and supports they need to live. We believe that as a society, we need to prioritize treatment and support for Canadians, not create a special pathway to death for people who are struggling with despair and loss of hope. MAiD must not be Canada's response to those who suffer. What the law says matters. It will have a direct impact on people in our communities, our churches, even our families. People who already face stigma and discrimination, who struggle to get needed care and support, and who may feel a lack of hope for the future, should never be offered death as a solution. We believe this is a crucial moment for us to speak up. There's still time to ask for a change to the law, but we have to act now. The EFC has launched a campaign to raise awareness of this coming change in the law, to share our concerns about its impact, and to urge people to engage. Specifically, to ask their MP to reverse the law allowing MAiD for mental illness. Time is short, and we know it will take a groundswell of responses from Canadians if we hope to see this changed. We know the odds are against us, but we believe we have to try. That this is a time for faithful witness, that regardless of the outcome, this is an important moment for those of us who follow Christ to speak up and to stand with and for those whose lives may be put at risk. Will you join us in asking for a stop to MAiD for mental illness before it's too late?